Hello everyone, welcome to my channel. In today's lesson, we are going to be talking about cranial nerve function and testing. The cranial nerves are 12-paired nerves composed of cell bodies with fibers that exit from the cranial cavity. Now, because these nerves travel through distinct locations in the brain, by assessing them, this can give us information about brain injury. Our cranial nerves are pairs of nerves that connect our brain to different parts of our head, neck, and trunk. And these nerves enable our brain to communicate with the upper body. These 12 nerves are named for their function or structure. Their functions are usually categorized as either being sensory or motor. Sensory nerves involve our senses, such as our smell, hearing, and touch. In this video, we will explore their function. You'll also be introduced to a cranial nerve exam. In a cranial nerve exam, this will help us to pinpoint specific disorders that affect our brain. By assessing one or more of the 12 cranial nerves, we'll be able to determine if there are proper functioning, brain injuries, brain lesion, herniation. We are in for an exciting video. Let's begin. Cranial nerves are identified by Roman numeral 1 through to 12. And there are different cranial nerve mnemonics that are memorable and can help you when you're studying and trying to recall the names of each nerve. The first letter in the mnemonics will correspond to the first letter of the cranial nerve. For example, one mnemonic that I found very helpful is the OOO, to take a family and go Vegas and Hawaii. Remembering cranial nerve function is also important. Now, if you recall, the function can be sensory, motor, or both. In this slide, sensory is color coded as red, motor as purple, and both as green. So we have the 12 cranial nerves, the olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, acoustic, glossopharyngeal, vagus, accessory, and hypoglossal. One mnemonic that helps me to remember the cranial nerve function is the some say marry money, but my brother says big brains matter most. And I really appreciated this image because it gives a visual of cranial nerve function. For example, the vagus nerve has both sensory and motor components. Cranial nerve 1 is the olfactory nerve. It is a somatic afferent nerve which innervates the olfactory mucosa within the nasal cavity. In order to test, you will ask the patient to identify an odor, be it soap, coffee, or cloves, for example. You'll present this to each nostril while the other nostril is occluded. We'll normally test the function of this cranial nerve if we're suspecting head trauma or lesions such as meningioma, or patients who do present and report abnormal smell or taste. The second cranial nerve is the optic nerve. This nerve transmits visual information. There are various tests that can be done in order to determine the functioning of the optic nerve. A fundoscopic examination can be done, which will reveal the physical condition of the optic disc as well as the retina and the blood vessels. The physician may also use an ophthalmoscope to view the back of the eyeball. As a nurse, you may be asked to perform a visual acuity test And to do this, you will use a Snell's chart, which will be somewhere in your department. You'll also test the visual fields. In order to perform a visual acuity test, you will ask the patient to stand 6 meters away from a Snellen chart. You will then record the number of the lowest line that the patient can read accurately. If it is that the patient does wear eyeglasses, they should be able to keep them on during testing. And this will let the physician know the distant vision. In order to test near vision, you will do the JGAR test, and the distance for that is 35 centimeter. And you will note the smallest print that the patient can read on either chart. Visual fields are assessed by gross confrontation. There are 4 visual fields, namely the nasal, superior, temporal, and inferior fields. You will position yourself directly opposite the patient and ask the patient to close one eye and look directly at the bridge of your nose and indicate when an object such as a pencil or the head of a pen is presented from the periphery of each of the 4 visual field quadrants becomes visible. The same test is repeated for the other eye. As the nurse, you are the control because both yourself and the patient are sharing the same visual field. It is important to note when you are doing this test, however, that the nasal side of the visual field is narrower because of the nasal bridge. Visual field defects can arise if there are lesions of the optic nerve, the optic chiasm, or tracts that extend through the temporal, parietal, or occipital lobes. Visual field changes resulting from brain lesions are usually 1/2 of the visual field is affected, and we call this hemianopia. Or 1/4 of the visual field is affected, and this is called quadrantanopia or mononuclear, where one eye is affected. We're going to just skip ahead to the 5th cranial nerve, the trigeminal nerve. This nerve originates in the 4th ventricle and emerges through the pons. It has both sensory and motor components and is responsible for sensations to the face or muscles of mastication, that's chewing and opening of jaws. There are 3 sensory divisions, namely the branchio-ophthalmic, maxillary, and the mandibular. For sensory, you'll be testing pain, touch, and temperature. In order to test, you'll use a cotton wool or just a soft touch from your fingers to 3 areas on both sides of the face. In order to test jaw strength, you'll ask the patient to bite down on a tongue depressor. If it is that the patient is able to clench their teeth, you'll ask them to open their mouth against resistance. If there's any weakness or jaw deviation when the mouth is open, you'll make a note of that. Cranial nerve 3, 4, and 6 are normally assessed together. So we'll now look at cranial nerve 3, which is the oculomotor nerve, and it originates in the midbrain and emerges through the pons. It has different functions, including eyelid movement and proprioception. In order to test these functions, you'll need a pen light. The oculomotor nerve has various functions, including pupillary constriction, convergence, accommodation, and maintaining eyelid position. To test these functions, as a nurse, you'll shine a light into one of the patient's eye to check for pupillary constriction and observe the size and shape of the pupils. This reflex requires that the optic nerve be intact. Damage to the oculomotor nerve can result in issues like dilated pupils. In order to test for convergence and accommodation, you'll ask the patient to follow an object. So the patient is supposed to focus on an object that moves towards their nose. Damage to the oculomotor nerve can lead to symptoms such as eyelid drooping or pupillary abnormalities and weakened eye muscles. This testing is extremely important for patients who present with neurological problems or neurological symptoms because the oculomotor nerve can be compressed by brain lesions near its exit from the brainstem. Cranial nerve 4 is the trochlear nerve. It has functions with eyeball movements and proprioception, and of course, it is assessed with cranial nerve 3 and 6. In order to test for proprioception, you can ask the patient to close their eyes and to touch their nose with their index finger. Another example of testing for proprioception is knowing whether your feet are on soft grass or hard cement without looking. Cranial nerve 6 is the abducent nerve. The abducent nerve arises from the abducent nucleus in the pons of the brainstem, and it is responsible for those lateral movements of the eyeballs. You'll be able to assess this when you're assessing cranial nerve 3 and 4. Cranial nerve 3, 4, and 6 all help move the eyes. They are tested together in what is termed as extraocular movements. In order to assess eye movements, you will hold a finger object about 20 to 30 centimeters from the patient's nose. You will then ask the patient to follow the movement of the object with only their eyes through the 6 cardinal positions of gaze. A normal response is that there's parallel tracking of the object with both eyes. Both eyes ought to move together and the eye movements should be coordinated and smooth. An abnormal response is a disconjugate gaze where the eyes do not move together. And this could be because there's either weakness or paralysis present in one of the eye muscles. Another abnormal response is that there is nystagmus, where there's fine, rapid jerking movements of the eyes. And if this is observed, you'll note this down. The nurse will also observe the corneal light reflex in order to evaluate for weakness or imbalance of the extraocular muscles. The light in the room should be darkened, and then you'll ask the patient to look straight ahead while a pen light is shone directly on the cornea. The light reflection should be located in the center of both corneas as the light is shone into the patient's eyes. And these tests can indicate that there is either dysfunction in any of these 3 cranial nerves. The 7th cranial nerve is called the facial nerve. It is responsible for taste, facial expressions, and proprioception. In order to test, you'll ask the patient to smile, wrinkle their forehead, or to puff their cheeks out. In order to test for taste, you'll be able to apply a sweet, sour, salty, or bitter solution onto a cotton pad or swab and then place it on the side of the tongue. And then ask the patient what is it that they taste. The eighth cranial nerve is the acoustic nerve, and it is responsible for hearing, balance, and orientation in space. In order to test this, you could ask the patient to stand with their feet together. And then in order to test for hearing, you could ask the patient to occlude one of their ear, and then you'll whisper something and then note what is it that they do hear. If it is that any hearing loss or hearing difficulty is suspected, this patient should really be referred for formal hearing or vestibular testing. The ninth cranial nerve is the glossopharyngeal nerve. Some of its functions include swallowing, controlling secretion of saliva, gag reflex, cough, taste, and also muscles of speech. In order to test, you can do a swallowing test. You can also ask the patient to say ah, and then you'll watch for upward movement in the back of the throat. You'll also note the volume and quality of their speech. The 10th cranial nerve is the vagus nerve, and it can be assessed along with cranial nerve 9. Cranial nerve 10 has both motor and sensory components. For sensory, it does receive impulses from the throat, the esophagus, the heart, the lungs, the stomach, and the small intestine, and then it will affect your heart rate and your blood pressure. In order to test, you'll perform a check for gag reflex, and you'll assess both sides of the throat. You can use a tongue blade to touch one side of the posterior pharynx and then the other side, and then you'll notice for symmetry of gag reflex, bilateral absence of gag reflex, even though these can sometimes be common among healthy people. The 11th cranial nerve is the spinal accessory nerve, and the function for this nerve is in our shoulder and neck strength. In order to evaluate this nerve, you'll be testing the muscles that it supplies. So you'll be testing the upper trapezius. So you'll ask the patient to elevate or raise their shoulders against resistance. So you'll be pressing down on their shoulder and you'll note the strength or any asymmetry in their ability to resist. Then you'll test the sternomastoid muscle. You'll ask the patient to turn their head against resistance. Again, you'll note for any symmetry. You can also ask the patient to rotate their head. The 12th and final cranial nerve is the hypoglossal nerve. This nerve innervates the tongue. In order to test or evaluate, you'll ask the patient to stick their tongue out. Then you'll inspect their tongue for atrophy, fasciculation, where there's involuntary twitching of the tongue, and you also evaluated the tongue for weakness, any deviation once they stick that tongue out. So we've come to the end of the video. Thank you very much for listening. As usual, remember to leave a like, comment, share this content with someone who you think may benefit. And on your next attempt, you will be able to perform a cranial nerve